Hi, this is Dr. Wells with Wells Medicine, and I wanted to go over some of the ways to increase ketamine's effectiveness and to sustain the results. Usually, after the first 6 infusions, we can get somewhere between 3 to 5 weeks of benefit out of ketamine infusions, and then we just do a maintenance infusion, one infusion every 3 to 5 weeks after that. Now, if you're changing medications, if you're going through an unstable family situation, or have a job loss or a medical situation, sometimes we get a little bit less than 3 to 5 weeks out of that, but sometimes we get a lot more out of that as well. If things are going great and you're able to make a lot of changes, we give a handout to everyone of everyday mental health recommendations that can increase the effectiveness of ketamine and that are great for mental health all on their own as well. Ketamine works really well on its own. 60 to 70% of patients experience a 50% reduction of symptoms by the second or third infusion without doing anything else. So it's not a requirement for you to do any homework, but we find that it works best when patients add 30 minutes of gentle movement every day, a little bit less than gentle if you have anxiety. So for those patients, we really want 20 minutes of a heart rate over 100 every day if your cardiologist allows that. We really encourage yoga, which counts both as movement and meditation. And if you're not doing yoga, we really encourage 3 to 5 minutes of meditation, mindfulness, or prayers. A decrease in alcohol and marijuana consumption, a decrease in benzodiazepines over time working with your psychiatrist, an increase in healthy fruits and vegetables and decreased processed foods, an increase in social outings and joining groups and clubs and finding things that you're interested in again. A decrease in screen time is a big one. So more than 2 hours a day, data shows every incremental increase in screen time increases the rates of anxiety and depression. So we really encourage patients at Wells Medicine to decrease their screen time to less than 2 hours a day, if possible. We know a lot of people work or do classes on screens now. And then cognitive behavioral therapy or CBT. Any kind of therapy obviously is great with ketamine, but we find that the 3 most common types of therapy that work the best with ketamine are cognitive behavioral therapy, acceptance and commitment therapy or ACT, and then also internal family systems or IFS. And there are some great apps and therapists doing all those kinds of therapy as well. But therapy also helps ketamine work even longer. One other thing that can really help in sustaining ketamine infusions is vitamins. So a lot of patients have vitamin deficiencies, which you can get tested on blood work, but we know that a lot of patients with anxiety and depression also have either vitamin D deficiency or deficiency in magnesium or both. So we recommend vitamin D, 5,000 international units every day. We recommend magnesium glycinate, 400 milligrams every night. And we recommend zinc, which is another less commonly tested for, but also very common deficiency in patients with anxiety and depression. So we recommend zinc picolinate 20 milligrams every day with your biggest meal of the day. There are some really great studies showing that 1 gram of EPA, which is a kind of omega-3 fatty acid, is equivalent to SSRIs in studies. So we recommend a gram of omega-3 fatty acids, EPA, specifically for your daily vitamins.